or when you press start timer. Good. All right, so today I am showing how to insert a Foley catheter into a patient. So I have reviewed my orders that were put in to insert the Foley for my patient. I've gathered my supplies. I have checked the expiration dates on everything, and everything is good to use. So now I am going to perform hand hygiene outside the patient's room and enter the patient's room. Hello, how are you?
I'm good, how are you?
Good. My name's Barbara. I'll be your nurse today. Do you mind if I set some of this material down?
No, not at all.
All right, I'm just going to set it on your bed here for just a moment. And ma'am, can you please confirm your name and date of birth for me?
Yeah, my name is Finn Utley and my date of birth is 12/24/1987.
Right, thank you, Miss Utley. Perfect, thank you. And ma'am, do you have any known allergies?
Yes, I am allergic to latex.
Okay, well I did see that in your chart, so I made sure to gather only latex-free items for the procedure today.
Thank you.
So your doctor put in an order to insert a Foley catheter for you. Have you had that procedure done before?
I think so.
Okay, so basically I'm going to be inserting the catheter to help drain your urine, and we will have a urine bag attached, and I'll just be monitoring your urine output. So right now I'm just going to get things set up, but please feel free to ask me any questions if you have any throughout this procedure, okay?
Okay.
All right, I'm going to turn all the lights on. Looks like your bed is locked. Let's move that up. Since there's someone next door, I'm going to pull these drapes to give you a little privacy. Let me just clean your bedside table. So how are you feeling today?
I'm feeling okay. How are you?
Good, good. Okay, so like I said, I'm going to be setting things up, but before we get going on that, when was the last time you were able to get yourself cleaned up a little bit?
I took a bath this morning.
Great, perfect. And do you need to use the bathroom now, or have you gone recently?
No, I just went like 30 minutes ago.
Perfect. Okay, well, great. Well, then let's get going on this procedure. If you don't mind, I'm just going to take this sheet down a little bit just to check things out really quick.
Okay.
Okay. And I'm gonna need your legs. You said you've had this procedure before, right?
Yes, I have.
Okay, so you know I'm gonna have to have your legs moved outward just a little bit, if you can kind of help me with that.
Okay.
Perfect. Okay, and if you can just do your best to stay there. Are you comfortable, or do I need to prop your legs up at all?
That's okay. I'm good.
You're good? Okay. All right. It looks like that area is clean, so I'm just gonna cover you up just a little bit while I get everything else going. All my material here. Okay. All right. This one. I'm just gonna keep this here for my trash. Make sure I have this side out find the corner here. We'll be needing these items. Okay, so now I'm going to put on my sterile gloves.
I can record one of you guys and somebody else can record Okay, so now I have all my sterile gloves. Okay. So now I am going to clean this just a little bit. These are extras. So I'm going to open up my swabs here that I'll be using for cleaning, and I'm going to set those out on the tray. Now, usually I would be using the lubricant that comes in the Foley catheter kit. However, for the models we are using a spray. So this does not seem sterile. However, like I said, I would normally not be breaking the sterile field to use this. So typically I would just use this the lubricant that comes in here, but instead I'm using this. Okay. Alright, so at this point I am going to take my syringe here. Now that I have my sterile gloves, I'm just going to push this down just a little bit. Okay, so I'm going to take this and connect that catheter piece here. Just get this ready for when we need it later. Hopefully it'll stay in there where it's supposed to. And I'm going to take this off with minimal, touching it minimally so it can sit in the lubricant while I prepare everything else. Alright, so I'm going to start cleaning this area. And I'm going to start with the outside furthest away from me, from top to bottom. Okay. Pull it out here, put it away. Next I will get the side closest to me, outside from top to bottom. Okay, and with the last one I will be cleaning the inside. Again, from top to bottom. You still doing okay, ma'am?
Yep. Thank you for asking.
Okay. Alright, so now I'm about
about to insert the catheter. I just wanted to let you know and make sure that's okay.
Yes, thank you so much for asking.
Absolutely. Okay, and please, if you feel any discomfort during this, please let me know, okay?
Okay, I will.
Believe it's gone in far enough. I can see the urine.
Great.
So at this point, I am going to push it just another inch or two since I saw the urine. So it should be in there far enough. And I'm going to push in the 10 mLs to inflate the balloon. Still feeling okay, ma'am? Still feeling okay, ma'am?
Yes.
Okay, great.
Thank you for asking.
Okay. Just like tug to make sure that that balloon inflated, and it did. I'm not feeling that it can come out in any way. So at this point, I'm going to, let me just cover you up a little bit. Get you a little bit of privacy. Hang this back over here on the side of the bed that does not move. And I will also attach this. Now I'm going to make sure to give it some slack. That way, in case you move it all, it shouldn't pull it all.
Okay, thank you.
You're welcome. The skin looks good in the area on the thigh here where I'm going to attach this. I'll be checking it periodically, but please, if you feel any irritation or it just doesn't feel comfortable, let me know.
Thank you.
Certainly don't want you getting any sores there from it. You just help me with that leg, lifting that up a little bit. Okay. All right, perfect. Still have a little bit of slack in there, so that's good. Okay. All right, I'm just going to clean up a little bit real quick. And get you a little bit more comfortable. Would you like me to put this back up for you?
Yes, please.
Okay. All right. Now, at this point, I am going to let me just change out these gloves first because they're a little bit hand hygiene. Okay. Now I'm gonna leave your call light there for you. If you need anything, please just press your call light and I'll get here and help you out.
Thank you so much.
I'll adjust the lights for you if you need them and move this. Let me just lower your bed for you. Okay, all right, and just let me know if you need anything.
Thank you so much.
You're welcome. All right, some minutes later I come back because I am going to get a urine sample. So I will be raising the patient's bed. All right, ma'am, this should just take a moment. I'm just going to get a quick urine sample that the doctor asked me to get for you. So, alcohol swab. In the area here, I'm just going to lift up your gown just a little bit. Okay, make sure I clean this area really well. Okay. And I'm going to cinch it here so that no urine, that I have the new urine stay here rather than go down into the bag. Okay, I'm going to draw up a sample. Okay. All right. Still doing okay?
Yep, thank you for asking.
And I can put the urine sample in here. Discard my. I will be putting a label on this and sending this to the lab. All right. So at this point, then I will be changing these gloves out. Hygiene. Each time that I would have left the room for a new procedure, I would have cleaned up the bedside table and wiped that off. So I'm going to do that right now. Remove all of my supplies here. I'm just going to move this for since I'm coming right back to remove the catheter. So if I weren't coming right back, I would leave the room, perform hand hygiene again, and document that I inserted the catheter and that I took the urine sample and then I sent that off to the lab. Make sure all of that would be in the system. However, right now I'm going to also show you how to remove the catheter. So I'll be coming back to the patient's room, knock on the door. All right, ma'am, I'm back here today to remove the catheter. So, let me see. Can you please confirm your name and date of birth for me?
Yes, my name is Finn Utley and my date of birth is 12/24/1987.
Okay, great. And ma'am, do you have any known allergies?
Yes, latex.
Okay, great. All right, so today I'm going to be removing the catheter that we inserted before. So we'll get going on that. So at this point I would, I'm going to change my gloves out. It's kind of different since we're meshing several steps together. Usually they would be all spaced out at different
Yeah.
times.
But I mean, I think if you just document it, it'll be fine. But so, you've got your.
So typically, once I'd be done with the inserting the catheter, I would probably get the urine sample right away and send that to the lab, or the order may not come until later from the doctor to get that sample. But I would leave a document for the day, and then at whatever time I got a new order that said to remove it, I would come back. So, but for this video, we're just lumping it all together. Okay, I'm going to just, if you don't mind, I'm going to lift up your gown. Okay. So I can start with, let me just go ahead and grab the syringe because we need to remove deflate the limb.
Yeah, no, I smell it. Oh, I just smell the orange white. Maybe I just did a really good job.
Okay. All of that water out. Yep, we have the 10 mLs in here. That's what we should have. Which tells me that this should be, the balloon should be deflated. So I'm just going to lift up your gown. There'll be a slight tug. Okay. I have a towel here for while I'm pulling it out to catch any urine that may come out at that time. And I can dispose of this entire thing in the trash can.
Oh, yeah. I need put
this off. And I will move your gown down now. Went ahead and checked for skin integrity where this was to make sure that there were no issues from having this around her leg. I'm gonna change my gloves one more time. Okay. Still feeling okay?
Yep.
Right. Like I said, I have your call light here. If you need anything, give me a call. You lower your head here. I'm going to make sure it's locked. It is. If you need anything, just call me. I'm going to clean off my table here, both wipe it down and get rid of all of my supplies. And I'm going to leave the room and document everything that I've done.